Good afternoon, members of the media present here with us this afternoon. Good afternoon to our viewing and listening public at home and abroad. I'm here with my team this afternoon, the Minister of Health and the CMO, and our other health officials and the Minister of National Security. Let me remind you that the last time I was at this podium, we explained to you where we were with respect to our response to the virus and the need to take the appropriate steps to give us our best chance of getting the best results. Today, by and large, what we have been hearing since we were here last have been good news. The technical staff from the public health department had said that we want a few more days to conduct the tests to determine from the results we are likely to get during that approximately 2-week period, determine what level of infection exists in the country, and to give us the comfort and guidance for new decisions to be made. The majority of our population, I should say the majority, have been at home, depriving the virus of the ease of jumping from one person to the other. And the results that we've had since I was here last indicated that only very few people have been confirmed. And in a while, the Minister and the CMO will give you today's update. But basically where we are today is looking at our position on this journey of self-protection to see which turn we need to take today. So at this point, I would not say much more. I would ask the Minister to give us our daily update from the Ministry and the CMO to give us his input as he normally does. And when they're through with that, I will come back in and then we'll have the question section after. Minister.
Thank you very much, Prime Minister. CMO, Dr. Michelle Trotman, Dr. Avery Hines, Minister of National Security, ladies and gentlemen of the media, and the listening and viewing public. So the report for today goes like this. Total samples tested to date, 2,271. Number of unique patients tested, 1,931. Number of repeated tests, 340. Number of positive tests still stand at 116. And you always have to take away the cruise ship component because that is a statistical anomaly of 52. Therefore, you are left with 64. Deaths still stand at 8, 7 in Trinidad, 1 in Tobago. The number of discharged patients to date, 104. The total number of community tests done to date under the expanded case definition is 652, 652. And to date, all 652 have come back negative. In our hospital system, we have one person hospitalized throughout the system. That person is at Couva, and we hope that that person can be discharged as soon as humanly possible. At the home of football, we now have only 3 persons in that step-down facility. So that is where we are, Honorable Prime Minister. The Tagarigua Center, as you know, has now been decanted of all 33 citizens who returned from Barbados. The only other facility that has not patients but people will be the UA Debe campus, where the contingent from Suriname came back, 69, 70. We got one more yesterday. That person came from Guyana, I believe. So 69 from Suriname, 1 from Guyana yesterday. So you have 70 persons in the Debe Penal campus. So that, Prime Minister, is the report as of today. Thank you very much.
Good afternoon, Honorable Prime Minister, Honorable Ministers, members of the viewing and listening public. So in addition to what Minister had said, just in terms of the healthcare workers, we have 20 persons at the Napa site, 20 healthcare workers. That site, as you know, was designated for that purpose. Just to use the opportunity to reiterate the new normal that we discussed a few weeks ago and we brought into the fore, which is essential and continues to be an essential component of the fight against COVID, starting with hand washing for 20 seconds, as we said before, the use of hand sanitizers in the absence of hand washing, covering your nose and mouth when you sneeze, cough etiquette, the use of masks, which a recent study from one of the European countries have showed that the use of masks in the general population reduced their burden by 90% of COVID infections. So it's very important to continue the use of masks. The use of sanitization in government spaces, open spaces, if and when that phase continues, sanitizing of tables, surfaces is very important, doorknobs, elevator knobs. The most important one to remember is that if you're at home, if you're sick, you need to stay at home. If you or your child is sick, you need to stay at home. So we need to reiterate it as much as possible. Going forward, as I said, it will be the new normal. We have to change the way we do business, to change the way we social distance or have distancing from each other, the way we operate generally as we go forward. Thank you, Prime Minister.
Thank you very much, Dr. Parasram. We need to back up a little bit to position ourselves for what we're going to do today. And in backing up, let me start by saying, what exactly are we dealing with? We're still dealing with a virus that requires human-to-human contact. And we are still required to deny the virus that opportunity. And that is what is causing all of this requests for physical separation. And of course, the best way that the virus can get from one person to another is from the orifices in your face, sneezing through your nose, coughing through your mouth, so cover noses and mouths, and we are denying the virus. We have been doing that and encouraging more and more of it. With respect to how we have managed the population, we did say that the approach was to take the population into confidence, having confidence that the population would do the sensible thing because it was such a personal response. It wasn't the ordinary ailment where you go to the hospital and doctors and nurses and healthcare givers in there looked after you. This problem, from day one, because of its very nature and its response, because of the response that had to happen, where the personal involvement was the determining factor, we determined that we were not going to have like a state of emergency to compel people and so on, because logistically you couldn't really do that. It was better to encourage the population to buy into the fact that you can protect yourself and others and the country by what you do at the personal level. We continue to do that. The next thing is, in the event that the virus comes to our country, as we anticipated it would, and the virus did come, and the preparations had to be made. And what was required is to always be in a position with respect to our health infrastructure and the presence of the appropriate healthcare givers and the equipment, and I probably would say the medication involved for comfort, that all of that was available to treat with whatever circumstance might arise in Trinidad and Tobago. The one place we did not want to be in, and that is still an imperative, is that we don't want to be in a situation where there are people who are afflicted, and when they turn to the healthcare delivery system, the system could not deliver. And that is why we have taken the steps that we've taken in what we call the parallel healthcare system and the various arrangements we've made outside of the normal hospital care to ensure that if and when people are afflicted, that they could get the appropriate care. I must say that we have done so, and we have done so quite well. And at this juncture, I want to once again thank and congratulate the managers, the thinkers, the decision makers in the public health sector, in the healthcare system in Trinidad and Tobago, for approaching it in this way and for guiding the government to this operation. I can tell you that as Prime Minister of Trinidad and Tobago, I have had a lot of communication with officials outside of Trinidad and Tobago, some of them quite high-level government officials, who were curious to find out how we managed to have put ourselves in this position, on what advice did we act. Because as you know, if you look at the international news in many countries, or some countries for that matter, you would see a conversation saying that certain kinds of information was not available and some information was hidden, and even have the conspiracy theories going around as well. And there are people who want to know whether we knew something that other people did not know. The answer is we did not get any special information. We got the information from WHO, we got the information from PAHO, but most importantly, we had within Trinidad and Tobago a population of public servants and their associates who were able to give us the appropriate advice, and the government took the position that we will make our decisions based on the science and trust the professionalism of our healthcare professionals. And I must say, it has worked very well for us. And what we can anticipate is that that standard of care would continue, and the government would continue to make decisions based on the science. We today are in a position, based on what we experienced as promised last time, we are in a position to make some adjustments to what we have been doing. We had asked that certain things be done to minimize the population that was away from the home. We had taken the position that we had a certain amount of essentials in terms of our commerce and some non-essentials. Today, we are beginning to do what is reasonable to do. I must tell you that the government has met in one-on-one again with our healthcare professionals. We discussed this in detail, and we are satisfied that what we are going to recommend today is the best step that we should take. We have broken up the next 2 months, or should I say from now to the first week of, for the next 6 weeks, we've broken it up into phases. Phase 1, Phase 2, and Phase 3, where Phase 3 takes us down to, it's more than 3 weeks, 5 to 6 weeks, 5 to 6 weeks, I would say. Because I want to talk to you from tomorrow down to June 20th, what horizon we're looking at and what the decision-making profile and what kinds of decision we have made and are going to likely to be making in that period, given the fact that we've got up to Phase 1, a good result to allow us to do the Phase 1 things, and if our profile continues to be like that, what we can do in Phase 2 and Phase 3. But let me detain you a bit longer by explaining to you that this is not a getaway card. This is a very dangerous phase that we are embarking upon. And I could tell you, it is easier for me as Prime Minister to have made the decisions to shut down certain things, to try and protect us from an outcome we didn't know we could get. It's easier for me to have done that than to do what we are going to do now, because I am a little nervous now about opening up, because we've seen what has happened elsewhere, and we know that the virus has entered our country. We are not virus-free. There's no country in the world which has declared itself virus-free. And therefore, as we are now beginning to open up a bit, we know that we are doing so, going out to live with the threat of the virus being present amongst us in the population. That means that we have to keep our guard up as we now take the risk of going out, whereas before we had been in a lot. What do we do when we go out? In Phase 1, which covers the period May 10th to May 23rd, which is tomorrow to the 23rd of May. We are going to take the appropriate changes in the regulations to give life to what I'm going to say now. Food establishments and restaurants would be allowed to open and provide food services across the country, but there will continue to be no in-service dining. There is to be no dining within the premises of the establishment. Food can be prepared and sold to persons on the go. Itinerant and non-itinerant businesses are allowed to commence curbside pickup and takeout, deliveries, and drive-thru, and of course, all our street food people are allowed to conduct their business, and we are asking, well, we will be establishing that this aspect of it come to an end at 8 p.m. So all day until 8 o'clock, general food service across the country, meaning that all the employees who work in this place, who were required to be at home to reduce the number of people moving around, they now will go to work, and they will travel, and they will go to the place of work, they will handle food, they'll prepare food, and food will be available for purchase in the normal way. And of course, we expect that the people who are doing street food type things, that they would observe the highest level of hygiene practice, and of course, the CMO and the Ministry of Health will issue further guidelines for business places that would be conducting business under this release that I've just mentioned. With respect to probably the most interesting thing for healthy people, the wanting to come outside to exercise, which is the original problem. Members of the public would be allowed to engage in restricted outdoor activities. This would exclude team activities or contact sport activities, and any activity that require or encourage gatherings. It means that you can come out to walk, you can hike, you can do whatever, but bear in mind, certain other things remain. Don't congregate in groups of more than 5. And if you are near to people, keep the distance of 6 feet away. Those things still remain. So if you're walking around the savannah, don't stop within 3 feet of someone to say hello. Don't hug anybody to kiss them and say, a long time I didn't see you. How you going? Don't do that, right? And of course, you will get the news of how they were going and what they were doing, because you know we're good at that. So please, this is the new normal. No handshaking, no hugging up, no kissing, and always, once you leave the home, to go anywhere outside of the home. Most important in this phase one, going into the other phases, going into the many months ahead, wear a face covering, wear a mask. You are required to do that. Because what we are saying, and what is the science and the sense, each and every one of us must behave as though we are carrying the virus. And if we are, we don't want it to leave us to go anywhere. Once you leave home, and even if you're home and you're among the elderly and so on, feel free to wear your mask, because you don't want any spittle or any body fluid from you from sneezing or coughing to go out. So your mask is not to protect you as much as to protect the people and the environment outside. So please, now that we're saying you can come out and do these things, you do so with a mask. So this would bring a lot of relief to those who have been cooped up, but by the same token, we still want an element of stay at home. If it is not essential for you to go out there, the stay home is still in place. If you are caught by being an essential service, you'll continue to do that. If your business, where you are employed or where you are operating, is now captured by these departments I'm mentioning here, then of course you come out. If you are not caught by these things, then remember the grounding. We need you to still stay at home if staying home is not conflicting with what I've just said. Right? If you're not working in a restaurant, you're not working in a business that is supposed to be opened, and hardwares. We are going to allow the hardware stores to open all day till 4 o'clock. So a longer period of time, meaning that you shouldn't congregate there. You have a few more hours to do business. So the flow of people to the hardware should be, it might increase, but because it's a longer number of hours, you shouldn't congregate. Go do your business, keep away from people, and get it done. So hardware stores will open, electrical stores, plumbing supplies, and so on. And of course, supermarkets, groceries, markets, and pharmacies, they will continue. The hardware stores will open from 8 to 4. The groceries and supermarkets and so will open from 8 to 6. They close at 6. They open at 8 and they close at 6. So this goes for the same shops and so on, right? But the regulations will spell it out, and they will be out from tomorrow, from tonight, I think. From Monday. Well, but the closing hours is 6. The closing is at 6. That's the important thing. Pharmacies close at 8. Supermarkets and others at 6. Hardware stores at 4. Those are the closing hours, right? And of course, when we do that, a significant number of people will now be expected to come out covered by these activities, because what we are doing is tentatively returning to some element of commerce. I should also say that the Minister of Health has granted approvals to 3 of our major commercial activities for reasons which are a little more than what I just mentioned. Because of our position in the international marketplace, we have taken the position now that the Minister has granted approval for the tobacco export business, WITCO, to prepare and resume operations largely for export. We've also done the same approval for cement, TCL, and the New Iron. Those 3 businesses have been granted approval for startup on Monday, is it? On Monday. And they'll move slowly or even more quickly into where they were. And the main reason for that is that we are, in the case of WITCO and TCL, well, in the case of WITCO, we are a supplier to the regional market, and we are very concerned about losing that permanently. So we come back out to maintain our market position there. With TCL, similarly, we have supplies and regional concerns. So we think we can do that a little earlier. And of course, with New Iron, we have been running the kiln, keeping it hot without production for the last 2 months. We think it is time that they go into some production without being necessarily increasing our exposure. So those 3 businesses have got ministerial clearance from the Minister of Health. Now that is phase 1. Those are the changes that we're going to make in phase 1, which will take us to May 23rd. What we'll be doing then is continuing the testing and monitoring as we have done for the last 2 weeks. And if we see no worrisome change, then we go into phase 2, which I'll mention now, which will take us from May 24th to 6th of June, which is to reopen the whole manufacturing sector. If by May 24th, the numbers are as good as they are now, then those of you who are engaged in any aspect of manufacturing, you can expect that the manufacturing sector will open back on the 24th. So you can start your internal preparations for that. And of course, public sector construction, all public sector construction, we already have some approved by the Minister of Health, like the drainage works, which we have to do in the dry season. The dry season. The Minister of Health had given authority to the Ministry of Works and its agents to do the drain cleaning and the river cleaning. That is going on right now because we have to use the dry season for that. So that was granted before. But we are saying, if we see the numbers continuing the way that they are, by May 24th, just before May 24th, we'll be able to say manufacturing is reopened, public sector construction has recommenced. And of course, that same phase 2, we will continue the 50% capacity of public transportation and maxis and taxis. Because of the closeness of people in transports, we will, during phase 2, continue that. Because as we bring more people out, we don't want to create the environment that we have been fighting before, which is we stay away to create this separation, but when we bring you close, we have to be concerned that we need to preserve that element of separation. So in phase 2, we will still maintain the separations in the public transport and maxis. However, we go on to phase 3, which is supposed to begin on June 7th, where all the public service will come back out to work with some element of flexi time where that is possible. Where flexi time is possible, we'll do that. And of course, we may even consider alternate days of work, depending on the circumstance. And of course, all private sector construction we expect can recommence at that time. Then we will increase the capacity by 25%, meaning that public transport and maxis can carry 75% of their capacity in taxis. But let me say this. In our discussion, phase 1, phase 2, phase 3, covering these 3 periods, May 10th to May 23rd, phase 1, May 24th to June 6th, phase 2, June 7th to June 20th, phase 3, we have said that as we monitor the situation, if the numbers continue to be just as good as they are now, we will take steps to advance towards us, the dates I've just mentioned, so that phase 2 can come earlier than May 24th, and phase 3 can come earlier than June 7th. But if, on the other hand, as we expose more people, taking a little more risk, if there is a spike and we believe that is not under control, then we will have to make the necessary sensible arrangements. And of course, if the spike looks serious and more dangerous, the only response is to resort to what we have done before, which we know has worked for us. So, having said that, each and every one is required to play his or her part so that we don't expose ourselves through lack of cooperation or misconduct, which could cause us to have to resort to what we had avoided and come to do phase 2, phase 3 now. So if we are in phase 1 and phase 2, and you still feel you have to go and party, and you have to disregard the wearing of the mask, and you have to disregard the physical distancing, and you assist in the infection of the country or the community where you are, what you are doing is forcing us to do what we have just done for the last 6 weeks. We don't want to go in that direction. We want to go in the direction of going from phase 1 to an early phase 2 to an early phase 3. And it is my hope that by early January, we said June 7th, but maybe June 1st, depending on if the numbers are good, to be able to say to you, the things that we identify as phase 3 activities, we can do on the 1st of June as against the 7th of June. All of that would be guided by the results that we will be getting in the continuous monitoring and testing that is going on. So I want to ask all involved, those of you like in the business sector and wherever else, and the public sector as well, to plan ahead in the event that we find ourselves, fortunately, being in a position to advance these dates from May 24th closer to where we are and bring the phase 3 closer to the end of May and June 7th. And of course, you will ask What are the other phases? The other phases are the opening of malls and the opening of beaches and so on. And phase 5, opening of cinemas. Well, if we get to the stage of being able to comfortably open cinemas, you know we're almost there. And there's one thing left after that, which is opening our borders. That is phase 6. And that will remain as it is now more than ever. Because if our virus load in the population is so low, then the only place, other than our own populating it, growing it here by misbehavior, the only place that we are exposed to will be an inflow of infected people from the outside. And to prevent that from happening, we do not want to squander the good results of the sacrifices we have made. So we will maintain our border closure until we are satisfied that the external environment is such that we can accept within Trinidad and Tobago persons from heavily infected areas outside. But in the meantime, if there are persons in Trinidad and Tobago who want to leave, Trinidad and Tobago is not a prison. The Minister of National Security and the authorities, based on what's going to happen with Caribbean Airlines and so on, it is quite possible that we might be able to allow some kind of traffic so that people can leave if there's a need for that service. If that need is not there, well, then we just continue to stay battened down until we are satisfied that bringing people in scheduled flights is a sensible thing to do. In the meantime, I trust by now you would have observed in practice the good sense of what we are doing in terms of allowing people to come back into Trinidad and Tobago. When we took the decision to close off traffic into our country by non-nationals, that was a step. The next step was to close off the border even to nationals who were outside. And it was understood that if the borders were closed, some people would be on the inside of that fence and some would be on the outside. It's unfortunate that some people were on the outside, and in every situation there was serious inconvenience. We knew that. We knew there'd be inconvenience. But there was a price that this country had to pay to be where we are today. I want to remind this country that had we, this very well internationally connected nation, not taken the steps that we had taken and allow ourselves to be penetrated in a way that the virus would have been in Trinidad and Tobago in such a concentration that it could have overwhelmed our ability to manage it, overwhelmed the health system we had in place, and of course, lead to a significant number of deaths, the conversation would have been quite different. Quite different. We've made the sacrifice. And for those persons who were inconvenienced, you have made the sacrifice. But we've saved ourselves. Many of us, we don't know who, but I could say many of us have saved ourselves or others from the ultimate sacrifice. And if you don't believe us, just look at other people's experience with the same virus and say, there but for the grace of God go I. We've lost a number of nationals, in case you all have not noticed, outside of Trinidad and Tobago. A number of our nationals died as a result of this virus in what they call the developed world. The developed world. Many of them died there. Died without even being able to get the kind of treatment that is commonplace in Trinidad and Tobago. Yesterday I was hearing about a family where the mother and the daughter, two nationals, mother and daughter, daughter was fairly young. Both of them passed away in response to the infection in a metropolitan city. So we have done, I would say, surprisingly well. Because when we embarked on this, we were catering for the worst. But what we had put in place and the results that we've got we can say that, thank God, we haven't got the worst. But we cannot at this stage let our guard down. And we must not do that. We must do everything to preserve this situation and even to improve on it. And the only way we can do that, especially now that we are reaching out to get back into commerce, to get back into the jobs. Because those of you who have had to abandon your jobs and looking for handouts from the social development ministry, there's no better thing for you to do than to be at the job and earning your salary as against trying to line up to get food handout. So the more we are able to bring people out of that situation of depending on the food support system and going to the workplace, the more we are able to do that, the better we ease the burden on the Treasury to try and provide that support. And we want to get back to a situation where more and more people are coming back to the workplace. But as we do that, we know that we are flirting with the risk of infections and reinfections. And that is why it is so important, as we do this, that the exhortations and the entreaties to do the simple things. Keep clean hands, wash hands, wash hands, wash hands. If accidentally you touch your face, it must be a clean hand touching that face. But try not to touch your face. Wear the mask. Sanitize. Use the sanitizing items. Keep yourself virus-free, but behave as though you're carrying the virus with the mask on. And keep a reasonable distance from the person next to you, whether it is inside or outside. Keep a reasonable distance. And we are trying here now to commence those activities where people can come out and do work, but at the same time separate themselves. Because once the virus can't get from A to B by virtue of sharing that space between A and B, the virus will be beaten. So we have to deny the virus that transmission highway between A and B. And it said it is 6 feet minimum. Try and do that. And those of you who are going to go out, don't congregate. If you're going to go and walk around the savannah or around the Skiller Park or wherever you walk a little away from the person in front of you. If you're passing someone, don't pass in their face. Step away a little aside. These are the norms coming up. That's how it's going to be going forward. And if somebody happens to absent-mindedly violate this code, don't get hostile. Even if you have to remind someone, remind them nicely so they too can remember, because sometimes you forget. Sometimes you forget, even though you want to cooperate. This is about cooperating, doing relatively simple things. And the target is to keep the virus suppressed to absence so that we can get back to doing the things that we would do in commerce, in social life. And of course, with respect to our schools, the schools will remain closed. The exams, there was an announcement this morning about the CAPE exams. The Minister of Education will give you details about that. And of course, we're looking towards the exam, the SCA exam, and we're looking towards a September opening, right? So hopefully, we are on the trajectory to do these things. So by September, we can get our children back into school. Right now, we're looking at getting them into an early mid-year vacation. August is a little away from it. Normally the school term the vacation would have started on the 7th of July thereabouts. So it's about 5-6 weeks early. And of course, parents are required to take responsibility for your children, especially in these times and under these circumstances. And there's one final comment I want to make to the people who have been receiving public support, especially food support. Let your conscience be your guide. If you know you have got food support, whether it's a food card, fresh food box, a hamper from the government or from your MP or from anybody, live and let live. Let it not be the most bold-faced and unconscionable get the food, knowing that there are others who have not yet got there first. I've had a number of complaints from a number of quarters where there are people who are trying to get more than their fair share. That is not who we are, and that is not what we recommend. Let your conscience be your guide. I distinctly recall making a tour of a flooded area a couple of years ago and being accosted by a fairly large family on the ground floor of a two-story house, telling me how they were abandoned and nobody had come to even get them a drink of water, and la, 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 la. And I was so concerned that this could have happened because I was told that so much was being done for these people. And to hear that they were so abandoned in this area. But then I was invited to see Granny upstairs who couldn't come down to make her part of the complaint. So I went upstairs to see Granny, and the veranda had about 24 cases of bottled water, which they had collected from distributors. And what shocked me with that is that that kind of complaint and that kind of behavior was being made in front of teenage children. That's what you were teaching the children. So ladies and gentlemen, we have a lot of people to help in this country, a lot. And we know that there are a lot of people who are suffering. If you have had some, let somebody else get a chance. Because the logistics of it is difficult enough already. And we do not want the strongest ones who are already in the line to come back in the line again, get to the front of the line and get a second portion or a third portion or even a fourth portion. Because we know that there are people who are shopping around for more than once. If we get going the way I just mentioned, most people will eventually get back to work, and this will become less and less of the kind of burden that it is on all of us. So at this stage, I would open the floor for questions, and you could put your questions to any of us here, and we will try to assist. I'm reminded that to make sure that there's an orderly return to the positions I mentioned, the restaurant arrangements start from Monday, not tomorrow, Monday. So there should be no rush this evening or tomorrow to restaurants. They're told today, they now know that. I presume that tomorrow will be preparations, and by Monday, you can begin to have good food from your favorite clean kitchens.
Businesses remain.
We still preserve that except for what I've exempted. What I've done today is given exemptions. We still maintain the essential, non-essential. But from the non-essentials, I've taken out now those bodies of activities, right? So we'll have more activity. We'll have continued activity as we had in the areas of essential, and we'll have more. But I might say, though, that the objective of minimizing the amount of people outside is still there. So if you are in an essential arrangement, or any arrangement, we're saying just use as much as you need, because we still require to reduce the population of people circulating. But we are increasing the number now because we have to do certain things. So we know that the number is going to be increased, but increase it only as necessary. So, but we leave it to good sense and cooperation, because I don't think anybody will be consuming more than they need for the sake of consumption. But we do have a lot of people to help, and we're hoping that the numbers allow us to get more and more people back to work as quickly as possible. Yes?
In terms of bringing back nationals, I'm not clear what...
Oh yes, I'd started talking about that and I got a little sidetracked. When I said the plan that we were using, we knew we had certain capacity in the country, and we knew that we could have been easily affected from outside, because you saw how easily that one group of people on the cruise ship had put us in a situation. There were many other opportunities for that to happen. We had to deny those opportunities. We also knew that if we had closed the border, as we did, close down Piaco, close the border, close the ports, if we allowed an opening of any kind, which would have rendered that closure ineffectual, then we would not have got the effect of a closed border. And that allowed us to bring people in a managed way. Those people who were in Barbados from day one, notwithstanding what you might have heard and the nastiness that followed, from day one, it was the government's position, the government of Trinidad and Tobago, to the government of Barbados. The border is closed, yes. Since they're there, they come under your quarantine arrangement, mandatory quarantine, yes. Okay, they'll be tested after 14 days because that's what the science says. We'll send you the test kits so you can test them, so when they leave to come here, and we are even more concerned, when they're coming here, it must be in clean transport. But in any case, when they come here, CMO will determine their condition, and it will be another 14 days of quarantine. That was the condition all along. Whatever happened after that and the interpretations, too sad for me to repeat. But the bottom line is, we now can report to you, we have such capacity in the hospitals, in the step-downs, in the layouts. We have good position now. And of course, those who went into the hospitals, thank God, most of them came out. 100 and how many? 100 and how many came out? We didn't know that then. We had to be catering for the worst. But now that we know that we have 104 came in and they went out, and the flow into the hospitals have been such that we can now say we have capacity in the event of incidents. We then say to the guy, those in Guyana and those in Suriname, come home. Right? And we are saying so. The Minister of National Security is granting more and more approval and managing the inflow. Ladies and gentlemen, that is what we had to do to be in the position that we are in now. And it is not every decision one makes that would find favor with everyone, because at the end of the day, each person sees first his or her own circumstance and his or her own interests. For those of us at the management level of the country's affairs, we could not see the individual interests. We were duty-bound to look at the wider public interests. And it's against that background that we are still managing the inflow of persons into Trinidad and Tobago, especially those coming from areas where the virus is still rampant. And that is why, with all the inconvenience, I said to you today, we'll keep our borders closed for a long time beyond phase 1, phase 2, phase 3. It's the last thing that we are going to do with respect to returning to some semblance of normalcy, because that is where the biggest threat lies at this point in time, other than our own misconduct within our borders. And so far, I must say that while everyone had not joined in, most people in Trinidad and Tobago are cognizant of what is required, and most people are cooperating. Let's increase that number. Gyms? The gyms are, that's coming in the other phase, because the nature of it and the body, well, I won't go to the details of Dr. Parasham can tell you a little bit more about that, but it has not qualified for phase 1. But I should say that from what I've seen there, Doc, I need to hear from you. This is not my doing, because I'm warned by certain people. Does this cover golf courses? Does phase 1 cover golf courses? You said no team sport.
No team sport, which, yeah.
Golf is not a team sport?
No, not so.
What? Explain that, because I've already explained that.
So, I mean, basically...
No contact sport.
Correct. So, no contact sport, no team sports like football, basketball, those kinds of things. Cricket as well. But, I mean, golf is generally a sport that someone can actually go onto the course by themselves. So, it's almost like walking, almost like being outdoors. So, it would include to some extent, but of course, you wouldn't want to have, for instance, a club opening where you could have congregation of people. So you can possibly go straight on.
The clubhouse, and of course, I didn't mention bars remain closed. Yes, okay.
Correct. Yeah, so similar things that the numbers are less than 5. that you're able to have social distancing in an open space. Other types of sports, you mentioned hiking. If someone wants to do that kind of activity, that should be welcomed as well to get someone some activity. No, those are indoor activities with quite a lot of people in the first instance. We're talking about outdoor activities. Yeah.
There's another group that I was inquired, the hairdressers and nail.
And they are later on because they, of course, the nature of hairdressing and the nature of those kinds of things is that you have very close contact. You can't not have close contact, and it's usually in confined spaces. So it will be later on, along with malls and other types of businesses of that nature.
Prime Minister, George Simonga from Guardian Media and CNC3. I suspect at this time we might have some concerned parents because as businesses open up, more parents will be heading back to work and they'll have children at home. Are there any arrangements that we put in place to accommodate or to bridge this difference?
Not from the government end, because I mean, one has to understand that the government has certain responsibilities which I think we have been discharging. And there are some things, like if for example, a parent has to have a small child looked after, certain kinds of arrangements have to come at the familial level. I think this is where this whole question of pandemic leave the discussion had started, but we could not get to a point of operationalizing that without the potential for significant abuse. So on a case-by-case basis, these parents are going to have to make decisions that are not governmental decisions at this stage.
What about immigration? I saw that have they sort of gone back in full speed?
As I said at the last press conference, some immigration services had restarted the passport appointments, etc. We were waiting for this announcement and the decision by the Prime Minister and the team, and now that it has been announced, there will be further rolling out. But we had granted extensions of things like residency and these applications until June, predicting that this thing would be going on for a while. So immigration will make its own announcement. There is no need for people to rush there come Monday morning. Immigration will make an announcement as a phase basis how they begin dealing with the supervisory orders, the applications for residency, the extensions of people's stay here, because we recognize the borders are still closed. Prime Minister, if I may be permitted, with respect to what the Prime Minister said about people being permitted to leave, we will continue to deal with that on a phase basis, because right now we're dealing with the farm workers who have made a request to leave. It came up today. That has been sent for legal advice, because of course we are very concerned about sending nationals out into areas where there is very active COVID spread going on, and that takes place right now with what we understand happening in Canada in the 2 provinces. So we are looking at these things on a very, very careful case-by-case basis and consulting at every step of the way with our healthcare professionals.
You mentioned that construction will be open. I was wondering if earlier in March, Minister Imbert mentioned the paying out of outstanding sums for contractors and consultants and so forth. Would that delay that in any way, since some of them are now going back out? How far along is it?
Actually, no. The payment schedules and the issues around payment should not interfere with when the actual work is going to start. In fact, a lot of paying has gone on in the last few weeks, so I think they're in an improved position. But I do know that a lot of eagerness is there for the work to be done. There are a number of projects which we had stopped suddenly when we did the close down, and those contractors in the public and the private sector, they're just waiting for the all clear to go back to sites. So we don't anticipate delays based on payments. Contractors will go out and start to work and deal with the payment schedule as they go along. And people are also concerned about the use of the weather. We have very good construction weather now. And while we are concerned about preserving our lives from the virus attack, we also keep an eye on how much of the dry season we can salvage with some of the projects that are exposed to damage or significant delays if the rainy season catches us at certain stages of the project. So I don't anticipate that payment stories would bring about any delay. Oh yeah, I mean, the Ministry of Finance has been paying a lot of people in various areas, some of whom are contractors, right? And a lot of what the Minister of Finance has said is an ongoing arrangement. So I'm sure there are people who are still to be paid, but a lot of payments have been made, for example, the VAT payments. But I'd leave those details for the Minister of Finance, who will give you maybe one day in the coming week. The Minister of Finance will come and give a comprehensive report as to what he's accomplished so far in getting funding to the various sectors and subsectors.
What about non-living domestic workers?
We still the medical professionals will still like those people to stay at home for maybe until an earlier phase 2. Let us hope that phase 2 comes earlier, Doc. They would come in phase 2, more than likely, domestic workers. Because well, let's put it this way. If we get the kind of results that we are anticipating, it would be sooner rather than later. Right? But it's not in phase 1. So another few days, because we really want to get these people back to work, yeah? Because many of these people have turned to the state for sustenance. And as early as we can, without exposing them unduly, we would want them to get back to their workplace. It's not so much that we want to help you out with the work you have home to do. we want to get these people back to their routines, but we don't want to expose them unduly. And so we need them indoors a little longer, just maybe another 10 to 12 days. I'm beginning to get a bit optimistic, and I'm hoping that my optimism is not misplaced, because as a country, notwithstanding what we may think, as a country we've done well. And the people of this country, I'm appealing to you to continue to do well.
What feedback?
Sorry?
Online, a lot of persons asking about religious institutions. What phase?
The religious institutions, the instructions remain the same. That is one area where 2 or 3 gather. You know the rest, right? Good. 2 or 3, we give you 5. So, might be. So for the moment, the instructions with respect to religious gathering remain. But we expect that the praying will increase.
Prime Minister, this time you have a lot of small and medium businesses that are claiming to be in deep trouble. Does the government have any intention to offer them sort of funding to maybe keep them afloat until the system is good?
Yes, we do know that this kind of sudden shutdown and stay away from the workplace and the production cycles in those small businesses, they have been the hardest hit, and they have had the least reserves and that's why a lot of what the government has done so far and is doing now is sustaining the people who are the denizens of those things. But the Minister of Finance has already made some announcements, and there's one area that we have not concluded yet, which is the kind of financial support that we will make available for small and medium enterprises that will allow them either to refinance themselves. For example, we put $100 million in the credit union. One of the main reasons for that is that these small businesses could borrow some small amounts of money easily at significantly reduced costs, just to keep body and soul together in this period of the shutdown. So we have done some things already, but we'll continue to do a bit more, because we want those areas to survive. We don't want that after we come out of this, and we will come out of it. When we come out of it, we don't come out of it with these enterprises as going concerns. We want people to get back on their feet, and whatever help is possible, whatever the country could afford, the government will try to make available in a variety of ways. I've seen recommendations as to how NEDCO will function what kind of funding can be made available for access. But we don't want people to believe that this is an environment in which you can take advantage of certain situations because it's free or it's there as the government. The government is carrying a burden on behalf of the taxpayers because it's not really, when you say the government, say taxpayer, because whatever the government is providing is being provided by the consolidated fund. It's the taxpayers' money. So it is, while we in the cabinet are making the decisions and the Minister of Finance and the ministry is expending the money, but it is really the taxpayers, the wider national community, that is making that contribution for persons to survive. And whatever you're getting there is coming from the wider national community, what the country could afford. That is going very well. I think when I leave here this afternoon, tonight, I've received a document which I suspect is the first draft. So I look at that tonight. But that is going very well, and I'm very pleased. A lot of consultation has gone on, a lot of digestion of situations. I'm hoping that we'll move smoothly into decision making, and hopefully by the end of the month we will have something to go to present to the public.
Minister DEYALSINGH, for elective surgeries, you have an idea when you return and how you're planning to deal with the backlog?
Yes, thank you very much. So at the Ministry of Health last week, I think last week, Wednesday or Thursday, we took a decision that we will be restarting elective surgeries next week. What we have done is ask Dr. Anthony Parkinson, who I introduced to the national population. He's leading the charge with the RHAs, getting the listing, prioritizing these elective surgeries. We have ring-fenced some PPE, because now with elective surgeries, you have to assume that every patient is a possible COVID carrier. So we have to protect the surgeons, the anesthetists, the nurses, and we have ring-fenced some PPE, and elective surgeries will restart next week, I believe. Yeah. So that's some good news. So what we are doing, like the Prime Minister, we are graduating back to a state of normalcy in the healthcare system.
Yes, a date was announced for CXC.
I know they met yesterday, Prime Minister. I don't know what the decision.
I heard on the news that sure.
I think I heard on the news July.
Yes, a date was announced this morning.
Put on your mic.
Yes, a date was announced this morning coming from CXC. And I think it's, let me not say it because I'm not entirely sure, but I heard a date this morning. That means a decision has been made. So I expect the Minister of Education will confirm that that a CXC date has been arrived at, and I think it's in July, early July.
Was there any general discussion on how?
Yeah, there was a general discussion on that. I went to Tobago for a couple of days of stay home, and I spent 8 hours in the CARICOM meeting. I could not believe it. We started at 10 o'clock in the morning and finished at 6 o'clock in the evening, and I was in Tobago hoping to have disconnected from the normal day's work. But the meeting was very well attended. What these virtual meetings allow is for persons who otherwise would not have been there to be there. Most heads were there, and we had a presentation. There was a presentation made by CAFA, and I could tell you that what we are doing here and what CMO and his team would have put to the government here, CAFA would have put an equivalent, even more conservative position to the CARICOM heads. CAFA and the experts at CAFA and their associates made presentations to the heads. But a lot of that meeting was taken up with the distress in the tourism sector, because as you know, many of our Caribbean neighbors are virtually entirely dependent on tourism. And that was, there are a lot of situations there. And much as the economies there are dependent on tourism, the whole question of when do we open borders to allow people in was governed by the science. So that is a big blow that we are taking in the region, because don't think that we are not involved, because if the hotels in those islands are not operating, our manufacturers in Trinidad and Tobago have a reduced market. So the markets in Barbados and Jamaica and Antigua and St. Vincent, St. Lucia, they consume our products. And they are now having to, we took a long time getting the details and on what exactly we're facing. So no decision was arrived at to open. The decision was that we'd still have to keep our territories closed. And there's the decision to meet with the cruise ship industry for some firmer talks, because they want to open up their business, but we in the region have to talk with them. There was a meeting that was planned before COVID to talk to the cruise ship industry with respect to the whole question about who's paying for what in the region. And now that we have been confronted with this COVID matter, this discussion is advanced. So that discussion of the role and presence of the cruise ship industry and who pays for what and how much in the region is going to be on the table. Yes.
So the request to the public utilities and so on to hold
What
3
request?
months. The TSTT, HDC, all of that stays in place.
Yes, that because remember we are catering for 3 months to June, so that will take us to the beginning of phase 3. That'll take us to phase 3. But what we've said, we are committed to the 3-month period to June. Some people are committed for 1 month, like some bank things were 1 month in the first instance, where we had dealt with government, the HDC, and so on. It is to June, because we had always said that we were sure that the horizon would take us to June. And now the things that we are required to do, those common sense things, like the hygiene and the distances, people are telling us now that we are going to be required to do this for much, much longer, until there's a vaccine and until some kind of breakthrough is made. So we just have to accept that some things go longer. But the relief would be in place, even though the news is good.
Right. Prime Minister, thank you. We've been getting a number of specific questions online, so I just wanted to use the opportunity. Car deal, what the Prime Minister has announced this afternoon are the specifics. So everything else remains the same. So I just want to make that point. So we're being asked about gardeners, we're being asked about bookstores, we're being asked about car parts and dealerships, car services. We considered all of those things and sought the advice from the medical experts, and we are clear it's only what the Prime Minister has announced. So it really is the opening of the restaurant and the food service industry. Everything else remains the same, and I just reinforce what the Prime Minister has said, that we will continue to monitor, and it is fluid. So all of the gardeners, the housekeepers, the car shops, the tire shops, the service shops, please remain the same. Prime Minister, they asked more retail services as well. The Prime Minister addressed that. Those things will come down the line. So, thank you.
But as I said, I gave some dates for the various phases, and I didn't list every single thing that's gone. But what I said is these dates are guidelines which would be influenced by good results in the testing program. So while we gave those dates, it is quite possible and likely, once we get good results in the near days ahead, that we'll bring those things forward. I know that people are anxious to get back to their livelihoods, but please don't forget why we came out in the first place. Do not forget why we are doing this. Do not forget why in the first place we took such drastic action. And don't for 1 minute believe that because we have not had a number of cortèges, a number of coffins purchased for this purpose, because that hasn't happened, that we have gotten away. This problem, the history would show, and the experiences around the world would show, 1 or 2 people have the potential to restart this conflagration that we escaped. It's not the whole country have to be sick for it to be a problem. 1 or 2 people could put us in a place where we don't want to be. And all I'm asking for is a little more patience, because with every patient day that we've added, and by patient I mean patience, not a sick person. Every day that we are a little more patient, we put ourselves in a better position to reduce the opportunity for the virus to spread. If we get anxious and want to do too much at this stage, we could cause a flare-up. We could move from sporadic results, which are comforting now, to community spread and panic. And history has shown, and is showing around the world right now, when you have that arrangement can be worse than what you had before. And right now we didn't have a bad opening. And there are countries that try to do too much in the beginning. And just like biting off too much and trying to swallow it, you get choked. We don't want to do that. Let's be a little patient for a few more days. Let's keep anticipating the good results, and as we get them, we are monitoring this on a day-by-day basis. And we would intervene based on what we are finding. We would intervene and make the adjustments, because we are now in the phase of trying to come back out. And don't forget, what is the objective? We want to minimize the number of people making contact out there. That's what you want to do.
Prime Minister said CSEC and Cape will be held in July, beginning the first week of July.
Yeah, that's the date.
He just said it will be held in July, beginning the first week of July.
CSEC and Cape. Well, I'm advised by long distance that, and I presume you're quoting the minister there. The minister has just called into the program to tell us, yes, CSEC and Cape, this is the 21st century, you know. Not passenger pigeons anymore or sailing ships. This is instant communication, and we're live around the world. The minister has just called in because, as I said, when I was coming here, I heard a news item coming out of CXC, and I'm now confirming it by way of the minister's call, that CSEC and Cape would be done in the first week of July.
Prime Minister, if I may, all the questions that are being asked about the shifting dates of who should open and when we should open, it is going to, as the Prime Minister said, it is heavily dependent now on human behavior. Human behavior. How we behave. How do we adopt the new hygiene methods that we have put in place over the past 6 weeks? That now has to become part of our daily existence. The measures that the Honorable Prime Minister has announced is not an excuse to go back to not washing your hands. Is not an excuse to stop wearing a mask. As a matter of fact, it becomes now more imperative as people move more that the hygiene methods be heightened. So with more movement of people, with the more relaxing of measures, what you have is an equal heightening of hygiene. And I'll give you one example. There's a case yesterday, Prime Minister, in South Korea, where a 29-year-old male man went to a nightclub because nightclubs were apparently allowed to be open. And that one interaction spawned 18 new cases. That is what we have to avoid. So whilst the Minister of National Security is getting messages about bookstores and cards and all that, what we have to preserve, as the Prime Minister said, is our current position. And as we start to relax, as we start to move more, the virus gets more opportunities to jump from person to person with movement. So the simple takeaway message, as we move more, as we relax more, the need for hygiene, cough etiquette, wearing a mask, hand sanitizers, washing hands, all that is part of the new normal. And I want to stress that as Minister of Health. Thank you, Prime Minister.
Let me just add to that. this wearing of the mask. The government has taken steps to order a number of suppliers to produce. We went through a bidding program, and I think I was told that 36 suppliers have qualified of various sizes, and in the next few days, those people should be authorized or be at work producing masks. So more and more masks will become available. This purchase would be for a few tens of thousands of masks, and they'll be available in such a way that there shouldn't be any difficulty in getting your face covered. In the meantime, if you don't have a mask, you have a bandana, even a kerchief, get it over your nose and mouth once you're getting out from home. And we will ensure in the coming days and weeks that masks are available, because they would be required for a fair period of time. And once you're coming out of the house, all persons should have a covering over nose and mouth. So that is what we...
So Prime Minister, someone from Tobago wants to know if they could just go to the sea to take a bath.
Ask them to call Gary.
Right now, we have some local economists who are preaching doom and gloom. What is the reality of the economy right now?
What?
What is the reality of the local economy right now? We have some local economists preaching doom and gloom.
And what's new?
So they're incorrect?
Long before COVID, there were people in this country preaching doom and gloom. Problem is that this country will survive. We will survive. We have been through very difficult situations before. And for those people who believe that life is a bed of roses, they might be living in that garden. But most people are prepared to play the hand that God has given them. We in Trinidad and Tobago have a propensity to see the worst of ourselves. We didn't put ourselves number 1 on the rating list or the Oxford list. We didn't put ourselves number 15 on the Oxford list in the economy. If you listen to some people, we shouldn't even be there on the list at all. But based on how we have managed ourselves, given the circumstances that we have, it turned out that we were assessed and found to be in a position to be grateful. Our economy is going to take a huge hit as a result of this virus appearing on the scene. It's a period of a pandemic. Let us not forget this. The whole world is responding to a virus that could kill people in large numbers, that is killing people in large numbers, that has killed some of our people. And the world is responding to it. And across the world, the economies are taking a hit. I saw this morning there's 7,000 planes parked somewhere. The whole airline industry, including our own Caribbean Airline. Caribbean Airline made a profit in 2019 and a little profit in 2018 and was looking forward to a good year in 2020. Between January and now, Caribbean Airline has moved from that rosy outlook to who's paying the bills. You have to keep the planes. You got to pay for them. The planes are not being used. You got to keep the staff. You don't send pilots home and then pick them up on Factory Street after. You got to keep the pilots because people operating planes are highly trained people. And if you're going to start back on any day, that day you need them ready and willing to go. So that industry, not just our Caribbean Airlines, but the world airline industry. And I'm seeing where it is said that many airlines may never go into the air again when this is over. The same thing with the oil industry. At 2 o'clock this morning, I'm seeing there are about 70 companies in the oil industry in the United States that may not come back into the business. We are not alone in this. And those who believe that we're doing something here particularly bad, and therefore our situation ought to have been different, that conversation is for some persons, but for the average person in Trinidad and Tobago, we know where we've come from, we know where we are, and we know where we're going. And that is the most a country can ask of itself.
Last thing, as you mentioned, Gary, Minister Young. So with the changes with the outdoor activity, have you had any discussions with the police?
While the minister is good, let me answer that question about going on the beach. Let us be disciplined. The beaches, this is Tobagoan, right? Tobagoans are supposed to be disciplined people.
What?
For the time being, the beaches are closed. And one of the reasons for that is that going to the beach has by its very nature a congregating effect. And while I'm on this subject, please let us not have opening up parties. Let us not having parties. I was shocked the other day when I heard about the death on the Maracas Road. That first, the offense of people in a truck tray, and secondly, they were coming from a party. If there was any time that nobody should have died coming from a party, this was the time. So please, let us just be a little more disciplined, and then when it is open, then we would appreciate it a bit more. Let's be alive to appreciate it.
Thank you very much, Prime Minister. The answer is yes. This morning we had our daily security meeting. The Commissioner of Police was present, as well as the Chief of Defence Staff and some of the executives of intelligence services, the NOFC, and we discussed how this rollout would come from Monday. And what I can ask through the Prime Minister and my colleagues at the Ministry of Health is we're really asking the population to do exactly as the Prime Minister said, be responsible. So we're looking at the social distancing because, as you heard the Prime Minister announce, itinerant and non-itinerant food sales, so that is back to our gyros, all the food side sales, must stop at 8 p.m. And we're asking people practice the social distancing. The police are going to be there, but it's not for the police to enforce each one and every one of us doing what we know we should be doing. But the police are aware. They've been putting in things in place because we've been discussing it. And I expect them to continue doing the great job they're doing along with the Trinidad and Tobago Defence Force. And I thank them for that as we continue in this next phase. Thank you, Prime Minister.
You have a question?
Yeah, I have a question. Charlene Lewis from TTT News. A lot of persons are asking me about the resumption of NLCB operations. What's the status with respect to that?
Stop. A little later on, because again, LLCB operations are linked to people, a lot of people moving around and moving to. But I guess very soon we will, probably in phase 2.
So in phase 1 is what we announced today. Everything else we start to consider.
Which is the opening of the door for traffic to go in the opposite direction. It's the first time we've done anything to bring you out. And the question now is how wide the door is going to open and how soon. But we're going to do that as we go along. Before I forget, I want, on behalf of the team, the medical team, where I am an associate, the medical team, many years ago when I moved into West Moorings, the gardener came to me and was very happy to be introduced to me. And he came the next morning and he told me he had a serious back pain. And when I told him that I was a geologist and I wasn't a medical doctor, he was so disappointed. But I'm happy to be here with the team, and tomorrow being Mother's Day, I'm sure the team would want to receive on my behalf and my family's behalf and my colleagues in the cabinet. Happy Mother's Day to all the mothers of Trinidad and Tobago. And that includes you too. But yeah, happy Mother's Day. I'm sorry that the house support is not coming out, but the best thing to do on Mother's Day is to look after the father. Now I'm in trouble, right? So happy Mother's Day to all our mothers, and we trust that with the difficulties that we're going through, the mothers will continue to steer the children and the men to a safe landing. Thank you all very much.